Hi, my name is Raymond Weiss. I'm the CEO for Grace Lutheran Communities, and I have the privilege today of having a conversation with our spiritual director, Pastor Deb Boynton. I'd like to share an opportunity to talk more intentionally about the well-being of our employees and how important, especially in this time of uncertainty, that we talk about care for the caregiver. And I know there's a lot of resources that are available to our employees. And so maybe it would just be helpful to share some of those, Pastor Deb, and how you feel that we can best support our employees at this time.
As we all know, since the World Health Organization declared the COVID-19 pandemic, the weight of this highly transmissible virus has seeped into all parts of our lives. And as healthcare professionals, we have built these routines of self-care into our very lives. But very often now, the things we are doing to save lives has disrupted our way of caring for ourselves. And so we are very fortunate that we have information and resource specialists available to us, and they provide free and confidential care 24/7. They provide it in English and in the Hmong language. And all we have to do is log on to greatrivers211.org, and we can see the link for all of the resources, or we can simply call 211 and talk through our situations of concern. We can receive counseling or merely a crisis intervention. They provide legal resources. They can provide anything we need for parenting concerns, any addiction concerns that we have, or even something as basic as shelter and food resources. So it is indeed a very helpful resource.
And thank you for sharing that, Pastor Deb. I'm wondering if you could maybe share a little bit about what you do personally and how you are able to reach out and make meaningful connections with our employees.
Well, fortunately, I am here able to meet people where they work, or they have the availability to call me or to text me, just to be that confidential listening ear and to recommend resources for them. But just having the ability to be with them during the day is certainly a great asset. It takes no additional time, and when something comes to mind and is bothering us, the quicker we can deal with that or address it, our day goes better, and we certainly are able to provide the needs and concerns of our residents and clients.
Thank you for sharing that, Pastor Deb. And I've heard it said, especially in times of uncertainty, that self-compassion becomes so much more important, especially in times of doubt and times that, as you had mentioned, that we just simply aren't sure about what tomorrow brings. And I know that self-compassion itself isn't really something that's always talked about, but maybe you could share a little bit about how important self-compassion is, especially during this time of adversity.
As healthcare providers, professional healthcare providers, we tend to be hardest on ourselves because of our training. And I think in part because that is simply the way that we are wired. And I think we've all been shocked with the number of emotions that we experience in a week. And certainly in this, as they say, unprecedented time, it's to be expected. And to be gentle with ourselves, to have that compassion and understand that this uncertainty and the amount of anxiety that we experience about life certainly requires us to have some kindness towards ourselves and be mindful of all that we have accomplished, because we have well in these past weeks to maintain our own physical and mental safety, and we have each other to talk to and to be encouraged by one another, and to encourage one another that we should be kind to ourselves, gentle with ourselves.
I think for me, it brings us back to our mission of providing spiritual care and responsive to the spiritual needs, not only for our patients, families, and residents, but for each other. And
Yes.
and it seems to me that what I'm hearing from you, Pastor Deb, is that there seems to be a reservoir of strength when we tap into our own self-compassion. And in a sense, we become better caregivers when we care for ourselves. Is that right?
Absolutely. Absolutely.
Well, that's wonderful to hear. If you were to think about some of the questions that some of our employees might ask, and how best to reach you and reach out to you, how best would you suggest they do that?
I think the most convenient way to reach out is to call me or to text me at 715-559-1915. And certainly if you see me, feel free to talk, but often having that moment of quiet or just the drive home and realizing I need to talk to somebody else, and a text or a phone call is certainly most expedient.
And I appreciate you sharing that information, Pastor Deb. And it seems like, too, that probably the most important piece to your ministry is your presence, whether that's virtually or in person, as we find ourselves during this time, and being a good listener.
Yes, yes.
Wonderful.
Yeah.
And so when you think about, especially during times of uncertainty, what are some ways that our employees, whether they are able to reach out to you or are able to take advantage of some of our other resources, like you mentioned, our 211, our other healthcare providers that they have access to, what would you say would be a good starting point for people, especially during these times of uncertainty?
I think having your own daily ritual, ways that you can separate your work hours from your time of relaxation with family, friends, pets. And that ritual may be as simple as, when you're taking a shower, that you just let everything from the day just simply wash off you. Just let it go down the drain. Or if when you're breathing, you are breathing in life-giving spirit and love, and you are releasing all of those things that tend to trouble us, from what you heard on the news to the way you were feeling at a particular time of day. And I think to realize as well that, in a pandemic time, all those emotions, well, they're strangely normal. And that's when we need to be most compassionate with ourselves. We have been trained and we have been utilizing our training, but this is something that we couldn't have imagined.
And I think that's very well said. It reminds me that our caregivers expend a tremendous amount of energy in showing up for work, in recognizing that they themselves have become teachers in their own homes,
Yes.
that they themselves have taken on a whole new burden of financial worry or uncertainty. And what I'm hearing from you is by being intentional about reflection and remembering even our sense of what we're thankful for, even in these times of trial, is so important. Because in a sense, what I'm hearing, Pastor Deb, is we have to find our anchor in the midst of all this change.
Yes, yes.
Wonderful. Well, Pastor Deb, I can't thank you enough for your time here this morning and bringing your expertise and wisdom so that we can share this with our employees, and all that you do to make our employees happy, healthy, and productive as we strive to become the employer of choice here in our communities we serve.
Well, it's been my pleasure, Raymond. Thank you very much. And indeed, we know we are stronger together.
Well said. Thanks again.